My name is Tracy Reed, and I want to thank everyone for attending the Expanding Healthcare to Rural Community of Jordan meeting this morning. Welcome, everyone. You are part of this project because you are part of the community, and you have witnessed the changes that the community has undergone in terms of access to healthcare services. We are here to develop better access to healthcare in the community by partnering with national agencies and locals to see that these proposed changes become a reality. The community has about 6,500 residents, and the median age is 29, but is aging rapidly. The town has both rural and unurbanized areas. Currently, the town has 2 healthcare centers with only one fully operational healthcare facility, which is St. Francis Health Center. And they provide both inpatient and outpatient emergency care. And currently, there are no healthcare facilities in the downtown area. The social detriments. Jordantown, just like many rural areas in the United States, experience barriers accessing health care. The rural populations are characterized with low income and poor insurance coverage. With the increased cost of health care, a significant number of people are unable to pay for treatment. And the increased opioid abuse among young people is a leading rapid rise in mental health issues. The problem is worsened by lack of resources and mental health services. Suicide cases is on the rise, and young people struggle with challenges of living in these rural areas. Widespread surveys of needs. Healthcare assessment through the widespread survey determined that Jordan area has 2 healthcare centers. There is no healthcare facility in the downtown area. Again, I mentioned that earlier. There is an opportunity of expanding the existing healthcare facilities to increase access to healthcare for locals. Building a new healthcare facility in the region requires huge capital, which is difficult to secure. A large percentage of town populations are not under medical insurance. They are not covered. This is limiting their ability to seek treatment wherever they have need of services. There is an opportunity to improve insurance coverage in an area as a way of improving access to health care. By way of the empty buildings in the town, these buildings can be hired and equipped to be used as healthcare centers, providing patient consultations, mental health treatment, and patient education. The change proposal. We need to increase access to health care. The rural-urban healthcare divide manifests clearly in downtown conditions and outcomes. Mortality rates due to unattended injuries, overuse of drug misuse, chronic disease are common in the rural areas. Jordantown, therefore, have high prevalence to comorbidities and diseases that can be prevented. The proposed change aims at partnering with difficult agencies such as the U.S. Department of Health and Human Services to improve health care access in the rural areas of Jordan by expanding St. Francis Healthcare Center, hiring more healthcare workers, increasing healthcare insurance coverage, and enhancing the patient's education. These proposed changes aim at reducing the cost of healthcare in this region, changing the cost of care to value based on care instead of fee-for-service type of care. The benefits. The benefits of the change. By increasing access to affordable health care, the overall health of the population will improve. Patients requiring emergency care to save their lives will be able to access it at the right time. Establishing new healthcare centers in the region will reduce congestion and waiting time at St. Francis Medical Center. Further, bringing clinics near locals will eliminate the cost of travel to seek care in far areas. The ratio of physician to patient is 1 to 1,000. By hiring more healthcare professionals, we reduce this ratio. Workload of an individual staff is directly related to their productivity. Optimism, physician-patient ratio will enable personalized care. Further, hiring more staff will create employment opportunities for the locals who will work in the new centers as nurses, physicians, and also the support staff. Drug abuse and obesity is a major issue in this region, and by enhancing patient education, introducing screening and mental health care services will improve the health of the community. With significant access to health care, the population will stay healthy and productive. The locals will therefore have the ability to focus on economic growth. Some of the challenges would be inadequate resources, poor communication, lack of insurance coverage, motivation, lack of support from the community, and a lack of coordination by the stakeholders. Lack of the proper coordination between the planners of the project and all stakeholders can lead to skepticism about the change initiative. Success of the proposed challenge relies heavily on availability of the resources, particularly financial resources and personnel. The lack of enough financial support is a potential barrier to the success of the project. And poor communication between relevant stakeholders is a potential barrier to the success of the proposed change initiative. The misinformation about the project and general lack of communication can lead to mistrust and overhaul of the project. The funding and partnerships. We'll have partnerships with the U.S. Department of Health and Human Services and St. Francis. Funding agencies to help find a leasing space for medical home. Stockholders will be responsible for budgeting. Organizations of funds and how they are spent will be also discussed. The development of health is currently partnering with local hospitals and communities to improve the access to health care and to improve the quality of healthcare services. The project also aims at creating a program that will work together with the community to enhance health education and wellness in terms of healthcare, resources, economical growth, and services. This is a plan for the budget breakdown. The project budget needs range from salary and wages to equipment, consultation, utility, and fringe benefits. The budget specifies funding needed, outlining where the funding will be coming from and how it will be spent. The proposed budget was created based on World Health Organization and the CDC guidelines of creating a healthcare budgeting project. The community health implications. The median age of the population is 30 years, with 70% of Jordan population being under the age of 40. This is a prime age for comorbidities and potential mortalities from preventable diseases, and a lack of healthcare centers in the downtown rural area of Jordan lead to delay in disease diagnosis as well as development of preventable diseases. Opening new healthcare centers, providing screening, emergency education, and treatment will improve healthcare access and consequently improvement of the overall population health. Increased suicide cases can be attributed to the lack of mental health care in this region. There is an increase in opioid abuse among our young people. The proposed project is therefore designed to decrease health disparities in this community and increase access to all types of medical care. Now I could open the floor up for any questions or anything that you may have. And then basically the proposed changes seek to solve healthcare access among other major healthcare issues in the community in order to reduce healthcare disparities and to improve the health of the population. This will be achieved through expansion of St. Francis Center, increasing healthcare insurance coverage, hiring more healthcare workers from the community, and improving patient education. Capital to finance the project will be acquired from the U.S. Department of Health and Human Services. The stakeholders will spearhead and coordinate the project, include the city management, school head teachers, St. Francis management, nursing staff, and representatives from the community. The coordination and shared communication between the stakeholders will be crucial in the success of this project. The program will be implemented in 3 stages: planning, budgeting, and negotiating for funds. The second phase is the actual implementation of the program by building and equipping the new facilities, training new hired staff, and increasing insurance coverage. And finally, the third stage will be continuous monitoring and assessment to sustain the changes. I want to thank everyone for attending today. Any questions, and I will be glad to answer them. Thank you.